I want to show you guys a quick self-assessment that you can do at home to test for hip pain, hip instability, and also ankle pain and ankle instability. This one is called the 1/3 knee bend test. So what you're going to do is get your balance on one foot. If you need to for balance, you can also hold on to something. And then you're going to do a single leg squat, but you're only going to come down about 1/3 of your total range of motion. So what you're looking for there is making sure that you're sitting back into it. You also want to look at your knee and your hip alignment with your ankle. If you are coming down and your knee has a tendency to come inward this way, that is something called valgus, and what that means is that you have some instability in your hip muscles and some weakness in your hip, which is causing your knee to bow inward. And then if you want to look down at my ankle, you can see my ankle's moving back and forth from side to side, which means I have a little bit of instability in my ankle. So if I'm playing a sport or doing something higher level like running, that's definitely going to put me at risk for injury. Another self-assessment that you can do at home is a modified version of the 1/3 knee bend test. So putting a chair behind you, getting your balance on one foot, and slowly lowering yourself into the chair. What you want to look for is, can you control it into the chair, or are you off balance? Do you just flop right down into the chair really quickly, or do you have control, and can you keep everything from your hip to your knee to your ankle all in alignment as you lower yourself down? If you can't, and you're lowering and you're wobbling all over the place, you have some instability in your hip, also in your ankle, so all the way down the chain, you have muscle imbalances, some weaknesses that definitely need to be addressed. If you don't address these issues, if your knee is kind of all over the place, wobbling around when you're doing this test, that's going to put you at a greater risk for an ACL injury. The reason for that, if you have a tendency, if you're running or if your sport involves jumping, when you lift off and land, if you're in this position, it's going to put more stress on those ligaments and can definitely put you at a greater risk for tearing those ligaments. If you're an athlete and you're experiencing hip pain or ankle pain, or if you know an athlete who is experiencing these injuries, please call our office at 703-450-4300 and we can get you set up with an evaluation, or you can click the link below.